right, good afternoon, everyone. Thank you for joining us today. The Division of Aging and the Division of Disability and Rehabilitative Services are partnering today to share tools and resources for care managers to identify, understand, and purposefully collaborate with families to address the needs of children utilizing attendant care services through the Aged and Disabled waiver, where the parents of the minor is paid staff. The tools and guidance that will be discussed today will be emailed directly to the AAA and ICM directors so they can disperse the information to you directly. We are also recording today's webinar and will make the slides and recording available on the Medicaid Strategies webpage in the upcoming days. Before we get started, we wanted to ensure that everyone knows how to turn on their live captions. So if live captions is something that you would like to use, you can turn on the live captions and subtitles by selecting captions and subtitles on in your video controls. And then to change the caption language, you'd select settings and captions/subtitles and choose the language that you want. If you've never been on a Teams live event, we thought it might be helpful to share how to ask a question. So on the side of your screen, you'll select a Q&A on the right side of your screen, and you type your question in the box, and then you would select send. So your questions are only visible to the presenters, and questions will be answered as time permits at the end of the webinar. So please keep in mind that today we're only going to address questions related to the paid family caregiver disclosure form completion and the companion guide. We also wanted to offer you an opportunity to sign in for today's meeting and to obtain a certificate of attendance. This is not required, but there is an opportunity to do that. So if you would like to do that, in the Q&A box on the right side of the screen, under the featured list, you'll find the link for the sign-in sheet. I've also added a couple of additional links there that might be helpful for you to reference. But if you click the link for the sign-in sheet and complete the form and hit submit, we will take care of creating and sending you a certificate of attendance. And it will have the title and date of today's meeting in an electronic signature. Please keep in mind, we cannot accommodate special requests for certificates of attendance. So with that, I want to go ahead and give an overview of what today we are going to cover. So first, I would like to introduce myself. So my name is Heather Dane, and I am the Chief Program Officer with the Bureau of Disability Services. With me, I have Kara Gingrich, who is the Care Management Services Manager with the Division of Aging, as well as we also have Kathy Robinson, who is the Associate Director of the Division of Disability and Rehabilitative Services, and Holly Wimsat, who is the Director of the Bureau of Developmental Services. So today we're going to just provide you an overview of kind of the current landscape and the changes that are happening. And then we will also present to you a paid family caregiver disclosure form and talk about what is included in that form and then some next steps. So please keep in mind that we are recording today's session, and a recording and the slides will be available on the Medicaid Strategies webpage in the next few days. So wanted to kind of just provide an overview. This is something that I'm sure you're all aware of, but what the current landscape looks like for FSSA's HCBS programs, or Home and Community-Based Services programs. So please keep in mind that this is excluding DMHA, which is the Division of Mental Health and Addiction. So this is only This is only including the Division of Aging and the Division of Disabilities and Rehabilitative Services. So currently, as it stands today, the Division of Aging currently has oversight of a number of different programs as well as 2 different waivers. So the programs are the Choice Program, the Older Americans Act, the ADRC support, and Adult Protective Services. In addition, they have the Aged and Disabled waiver and the Traumatic Brain Injury waiver. The Division of Disabilities and Rehabilitative Services, we currently oversee the administration of the Community Integration and Habilitation Waiver, which is also known as the CIH waiver, and the Family Supports Waiver, which is also known as the FSW waiver. So as I'm sure you have heard, there are changes in the way that the HCBS waivers and programs will currently be overseen. So as of July 1st, 2024, the information on your screen is how the oversight will look. So the Division of Aging will continue to have oversight over their Choice Program, their Older Americans Act programs, their ADRC, and the Adult Protective Services. But then what is now known as the Aged and Disabled waiver will be split to ages 60 and over will be the Pathways waiver, which is the new Managed Long-Term Services and Supports waiver. And that will have the Office of Medicaid Policy and Planning oversight. So that waiver, the Pathways to Aging waiver, which is ages 60 and over who meet nursing facility level of care, they will have the oversight of OMPP. So then the Division of Disabilities and Rehabilitative Services will then have oversight of what will be known as the Health and Wellness Waiver. And so that is what we know as the Aged and Disabled Waiver, but that will be for individuals who are ages 59 and under. We will also have oversight of the Traumatic Brain Injury waiver, and we will maintain oversight over the CIH and the FSW waivers. So the transitioning of the oversight is a waiver amendment that is currently out for public comment and will be until Friday. So please feel free to review those waiver amendments and provide public comment as you see fit. So, as many of you know, as noted in FSSA's presentation to the State Budget Committee, the state team identified a potential $900 million variation from the April 2023 Medicaid projections. So the FSSA team has been working hard to continue reviewing data, policies, approved waivers, and current waiver drafts to better understand the drivers behind this variance. We did this in order to truly understand the issues in order for approaches we implement to be as tailored as possible. And we have worked to maintain our focus on all the people we serve and sustaining the forward momentum on existing agency initiatives. The items summarized here are identified as the primary drivers of the forecast variance based on our review and analysis. So the decrease in the federal FMAP has contributed to as a driver. The federal government funds a percentage of the Medicaid program with state dollars, with state dollars making up the remaining percent. So the federal percentage is redetermined every 2 years, and while a small percentage increase, the impact in a budget the size of Medicaid is significant. It's worth pointing out that FMAP is ultimately a positive for the state as it is an indicator of our improved fiscal position. In addition, the pharmacy rebates were less than anticipated, and there was a delay in the implementation of the new ABA rates. So additionally, there was an unanticipated growth in enrollment and utilization of the Aged and Disabled waiver. So in our review of data, specifically the growth appears to be related to the utilization of attendant care. In considering our key approaches, we were looking to implement strategies that minimize overall impact to recipients and has a focus on strategies that actually address the specific drivers of the forecast. However, we did also identify some broad strategies to minimize the impact of the projected forecast. So while strategies have been identified, we do not anticipate the projected impact of all of these initially identified strategies to fully address the projected shortfall. We are evaluating the home and community-based enhanced FMAP and potential reallocation strategy in terms of how these funds are being currently leveraged by FSSA and whether these funds can be appropriately used per the terms defining the allowable usages by CMS to contribute in assisting and positively impacting the projected shortfall. FSSA has also put a pause on the 2% rate indexing planned approach that was approved by the legislature in the last session and presented in the waiver amendments that were most recently out for public comment this past November and December. As part of these key strategies, FSSA will adjust which service plans on the aged and disabled waiver are auto-approved and which service plans will be reviewed by state staff. The review will focus on service teams' appropriate application of person-centered planning and assessing appropriate service utilization according to the CMS-approved waiver definitions and allowable practices and service planning requirements. Based on our data and the existing service definitions in particular, we plan to look closely at attendant care, home and community assistance, structured family care, caregiver coaching, and community transition. A state team has been identified to review the service plans and establish a process to ensure uniformity and consistency in the reviews. One of the other areas we are targeting involves steps and practices we can employ to more fully ensure service definition compliance. FSSA will be reinforcing practices to ensure all services are approved and delivered in a manner consistent with the federally approved service definitions for these services. We do plan to have care managers and providers trained on home and community assistance requirements, and in the next waiver amendment currently slated for 2025, FSSA plans to clarify the service definitions of HCA and ATTC, or attendant care. Our team is developing and will be administering an aligned training across our FSSA divisions to ensure requests are reviewed with greater uniformity for specialized medical equipment, home modifications, and vehicle modifications. Legally responsible individuals in attendant care compliance and structured family caregiving provisions and compliance are another section that we are looking at. The currently approved aged and disabled waiver does not allow for legally responsible individuals to provide attendant care. FSSA will ensure that practices reflect the CMS approved A&D waiver in regards to legally responsible individuals, which are parents of minors and spouses, providing paid services, in particular attendant care. We want to create a sustainable path for parents and spouses to support the waiver member, and going forward, that will be via structured family caregiving and not via attendant care. Structured family caregiving takes into account the unique nature of receiving supports through a live-in caregiver. It emphasizes maximizing the member's abilities and independence, as well as supporting the caregiver through training and support. As a result, the service requirements include regular home visits from a caregiver coach and/or a nurse, along with respite care. This is all delivered through a daily reimbursement rate that allows for fluid movement between daily life and care needs. As a result, this model of care is ideally suited in supporting LRIs or legally responsible individuals who are being paid to provide care to their loved one. Allowing LRIs who are being paid to provide care to their loved ones through structured family care recognizes the important role of key family members in caregiving while ensuring appropriate support and protections exist. So you may be asking, how are we going to move forward through this change? We will be supporting care managers, providers, and members to ensure compliance with the LRI requirements through notification process and reviewing service plans. So please first keep in mind that no new LRIs should begin providing attendant care services as of January 17th, 2024. We are currently putting system edits in core to ensure compliance with this. An IHCP bulletin was published on January 30th, 2024, and includes details on what information needs to be submitted with provider claims. Members who have a legally responsible individual providing attendant care now will have several options. For example, they can transition to structured family caregiving if they want an LRI to continue to support them. They may also choose to have another non-LRI attendant provide care. LRIs who are spouses will be able to make this transition now, and we are creating a process for parents and children via a waiver amendment. In the interim, parents will be able to continue providing attendant care until structured family care by a legally responsible individual is authorized by CMS. However, they will need support from their care manager and service teams today and going forward in thinking about the considerations and planning for that transition. One important note is that even though individuals continue through July, members will continue to have their regular service plan reviews and plans are eligible for changes just as they normally would be. Changes to our waivers are reflected in the drafts that are currently out for public comment until this Friday, February 16th. We will be working to implement these changes over the next 60 days. So as a reminder, a legally responsible individual is defined as the parent of a minor child or spouse. With the effective date of July 1 for LRIs only being able to provide structured family caregiving, FSSA has created a paid family caregiver disclosure form to assist care managers in obtaining the necessary information to support families through the transition. Again, please keep in mind that LRIs approved for attendant care initiated by January 17, 2024 are approved to continue to provide attendant care until July 1st. Additionally, please keep in mind that at the end of the PHE also ended the allowance of care managers to have their quarterly visits completed virtually. In-person visits should have resumed at the end of last year. The completion of the form can be done virtually, by phone, or during a scheduled face-to-face quarterly meeting. The completion of this form does not replace the requirement or need for a quarterly visit. So to assist care managers in conversations with family, FSSA has also developed a document to provide a side-by-side overview of attendant care and structured family caregiving. This document will be shared immediately following this webinar to the AAA and ICM leadership to share with all of you. This document will also be made available on the Medicaid Strategies webpage in the next couple of days. The document will outline the purpose of each service, what's included in the delivery of each service, address questions related to the delivery of skilled care, as well as what the rate structure is for each service, along with how compensation is determined by providers of those services. So I will now turn it over to Kara, who will share with you information related to the disclosure form.
Thank you, Heather. Just as a reminder, we will be sending out the link to the disclosure form along with the companion guide after this training. We understand that you don't have access to the form that we will be discussing, but we will be going over the questions so that it should make sense once you do have that link. This presentation is being recorded in the event that anyone needs to refer back to the training, and you can always reach out to the Medicaid email or visit the Medicaid Strategies website for the most up-to-date information. I believe that both of these will be listed in the chat for you. So like Heather said, we want to be able to plan and understand the needs and supports of the children and families currently utilizing attendant care services through the aged and disabled waiver where the parent of the minor is receiving payment for providing the attendant care services. The Family and Social Services Administration is requesting that care managers complete the paid family caregiver disclosure form by March 15th, 2024. This form is required to be completed for any minor child utilizing attendant care services through the A&D waiver and when the parent of that minor child is being paid to provide the attendant care. This form must be completed by the care manager alongside the parent. Care managers can complete this form virtually, in person, or on the phone. There isn't a requirement for this to be completed face-to-face, but we do want to make sure that you are engaging with parents when you're having these conversations. Once you have this information, we want This to help drive service planning and identify areas where care managers can support families in thoughtful planning and preparation in advance of that July 1st, 2024 transition date. Next slide. Just to make sure that we're all on the same page, there's a few definitions that we want to identify for the purposes of this training. A legally responsible individual, you may see this abbreviated or called an LRI. This is the parent of a minor child or a spouse. A paid parent caregiver is a legally responsible individual who is currently being paid as an attendant care staff through the age and disabled waiver, and a minor child is an individual under the age of 18. So now we're going to talk about the form itself. This first section requires the basic information about the individual receiving services, their care management team, and the paid parent caregiver. All questions will be required to be answered. You will first have to enter your care management agency, your name, and email as the care manager. Then you will be asked to enter basic information about the child, their HIPAA name, which is their legal first and last name, RID number, and date of birth. Then you will need to enter the name of the paid parent caregiver. Please be sure that you provide the name of each parent who is currently being paid as a caregiver under attendant care. For instance, if mom and dad are both being paid, please provide both of their names. You will also be asked for the approximate number of hours that are being provided by the paid parent caregiver per week. This does not include attendant care hours that are being provided by somebody who is not the legally responsible individual. So if a child is approved for 40 hours a week of attendant care, mom is being paid to provide 20 and the grandmother is being paid to provide 20, care managers would need to choose the option labeled 1 to 20 hours a week because that is the number of hours the parent is being paid to provide. We know that there are many reasons why a parent may have chosen to be a paid caregiver. Therefore, in this section, you will be asked to gather the reasons that the parent has chosen to be a paid caregiver. This information is really intended to assist the care manager in better understanding the barriers or concerns of the parent in obtaining staffing support. If the box Other is checked because the options do not capture the situation, please make sure that you are providing more detailed information by clicking on the text box and entering the information. Section 2 is going to ask about who lives in the home. The form allows for the care manager to choose multiple answers so that all of the adults living in the home are properly represented. For instance, if the child lives with their mother and grandmother, you will select both the one parent and grandparent boxes. The questions related to employment status allow for the care manager to better understand the employment status of any adults living in the home and have thoughtful conversations around any financial needs of the family and connect to resources. The employment status does not include being the paid parent caregiver. So if a parent's only employment is through the attendant care provider, you would not include that as part of their employment status. The form allows for the care manager to capture any other children who are living in the home. This does not include the child receiving attendant care for which the form is being filled out. If there are additional children living in the home, then a yes answer will go to additional questions to better understand the number of other children, any special health care needs, and any formal services for any other children. This provides an opportunity for the care manager to better understand the needs of the family as a whole while also connecting the family with additional resources that may be available. If there is another child in the home receiving attendant care services from a paid parent caregiver, they will need to have a separate form completed. Section 3 is geared to help the care manager better understand the support needs of the child as it relates to skilled care needs. The first question is related to the caregiving support for the activities of daily living that the child requires that another child of the same age would not need. The question allows for multiple answers to choose the caregiving supports that the child needs that they would not need otherwise if they did not have a disability or special health care need. For instance, if the child is 1 year old, it is not developmentally appropriate nor expected that they would be able to do tasks such as using the bathroom, bathing, or dressing independently Therefore, those boxes would not be checked. However, it is developmentally appropriate and expected that a 12-year-old would be able to do those tasks. Therefore, if assistance is needed in those areas, you would check those boxes. The next question in this section is related to the equipment the child uses regularly. A helpful way to think about regularly is if the family and child were traveling and did not have access to their home, what equipment or devices would be necessary to take with them to ensure the child could be supported safely and appropriately? This question also allows for multiple answers. For both questions, an option of other is available, and if chosen, please specify those responses within that text box. Section 4 allows for the care manager to better understand what a day in the life of the child and family looks like based upon their stage of life. With this information, you will be guided on how to best support the child and their family through connections and resources. First, you are asked about the child's life stage. Based upon the life stage, you'll be taken to specific questions to possible formal services that may currently be in place. For instance, when infant toddler 0 to 2 years old is chosen, you will be taken to answer additional questions related to their participation in First Steps. When preschool 3 to 5 years old is chosen, you will be taken to questions related to their participation in preschool or kindergarten programs. When school age 6 to 17 years old is chosen, you will be taken to questions relating their participation in the school system. Due to the date of the child's 5th or 6th birthday, they may be enrolled in kindergarten or first grade. Please choose the child's current age and answer to the best of your ability their involvement in public school offerings as it relates to the question asked. All stages will ask if the child receives applied behavior analysis or ABA services. A yes answer will ask additional questions to better understand where and how often ABA services are being provided. All stages will be asked if the child receives any therapies in the home or in a clinic. This does not include First Steps or ABA services. These therapy services may be accessed via the family's private insurance or Medicaid state health plan. This can include, but is not limited to, physical, occupational, speech, aquatic, or hippotherapy. A yes answer will take you to additional questions about the total combined hours of these types of therapies the child is receiving, as well as where they are receiving those therapies. All stages will be required to answer a question as it relates to Medicaid prior authorization, also known as Medicaid PA. Medicaid prior authorization includes the approval of home health support available through the Medicaid state health plan. More information can be found in the IHCP Provider Reference Module under Home Health Services. This question does not include if the family can access staffing, but rather if the child is approved for the hours. Based upon a yes or no question, additional questions will be asked related to if a request has been submitted, how many hours are approved, and how many hours the family is able to get staff. All stages will be required to answer the question as it relates to informal support. The purpose of this question is to provide the care managers with an avenue to fully understand all of the activities and relationships in the child's life and further connect families to resources that may be of interest and value to the child and their family. In the final section, families will be asked if they are intending to move into the structured family care service effective July 1st or continue with attendant care using a caregiver that is not a legally responsible individual. This section is intended to provide an avenue for discussion on how the family would like their services to continue after July 1st to allow time for thoughtful transition planning. The information collected here does not serve as final decision or commitment. We want to encourage everyone to start having conversations regarding these transitions as soon as possible. Care managers should continue to have conversations with the family prior to the July 1 deadline to answer questions, address concerns, and determine the chosen path moving forward. Care managers are responsible for updating the service plans to reflect the change in the services and work to prevent any gaps in services. So as a reminder, this disclosure form is intended to support care managers in understanding the holistic needs of the children and families and assist with person-centered planning as we move forward. FSSA will send out a link to the disclosure form as well as the companion guide. The webinar is being recorded and will be posted on the Medicaid Strategies website. Care managers, we are asking that you complete the paid family caregiver disclosure form with a paid parent caregiver by March 15th, 2024. This form is required to be completed for any minor child utilizing attendant care services through the A&D waiver, and the parent of the minor child is being paid to provide that attendant care. Again, we just want to remind you that the Medicaid Strategies website is a really great resource for both care managers and families to have the most up-to-date information and guidance. Everything is being posted there, so please refer back to that website with any questions or concerns. Any questions or comments regarding the Medicaid forecast or LRIs should be directed to the Medicaid email. Questions related to the completion of this form can be sent to medicaid@fssa.in.gov with the subject line, Paid Family Caregiver Disclosure Form, and I do believe that we can add that to the chat for everyone. So we appreciate everyone taking the time to attend today.
Thank you, Kara. We have just a couple of questions related to the form that we'll address here. And as a reminder, in the announcements, in the published announcements, there is a link to access the resources related to the transition from legally responsible individuals providing paid care to their minor child or spouse. So I would encourage you to look at that resource. No, we will also be sending out that additional resource as soon as the webinar completes. That is kind of a side-by-side from the structured family care to the attendant care. So that will provide you with some additional information. And to please be sure you are following the Medicaid Strategies webpage where all of the resources will be available to you. So I'm just going to address a couple of the questions that we have in regards to the disclosure form. So there is a question related to, do we want to know if Medicaid PA has been pursued but not provided due to staff not available? And so there is a section where we are asking that information. And so I believe, yep, so I was going back to that slide. That will be in section 4. And so there will be a question that will ask you if there has been an application for Medicaid PA hours. And so based upon those, if you say yes or no, there will be additional questions that pop up. So there will be an opportunity to say, yes, we've been approved, but no, we're not able to currently utilize those. So that will be part of the form that you will be able to complete. Another question was related to gathering PHI for other children in the home not receiving waiver services. So we are not asking for you to obtain any information, personal health information for other children in the home. The purpose of that question is really for you to better understand as a care manager what the dynamics of the family are and what other considerations there may be as far as being able to care for the child who is receiving waiver services as well as other children in the home. In addition, there was a question, sorry, I was going to switch my slides. There was a question related to what action should be taken if a parent refuses to complete this assessment? So that's a really great question. And so we realize that some parents may not want to share some of the information that you're going to be asking. So we would ask that care managers do the best that they can to ask them certain questions or to ask them all of the questions with the form. So please keep in mind that the form should be completed by you as their care manager, but it should be completed in conjunction with the family member. So if the family member does refuse, a lot of the information that we are asking for you to gather, you probably already know, so, or have a good idea of. So we would just say, answer those questions to the best of your ability, and then use that information. What we really want is for you to use the information obtained through the form to help inform your discussions with the family about how to move forward as of July 1st. So I wanted to kind of go through here. Is there an estimated amount of time that the paid family caregiver disclosure form may take the care manager with the family? So, I think this is just going to vary based upon the family, but I would anticipate that the form really, to go through those questions, shouldn't take any more than about 30 minutes. So give or take, it may take more if you're really having some pretty good in-depth conversations with them, with the family member, if they're ready to kind of have some of those discussions as you're asking those questions. Or it may take less if there's just not a lot, if there's a lot of no's that are being answered through the form. So I would say on average, probably about 30 minutes. So it says, will FSSA be accessing the information form or accessing information from the form somehow to also be able to be informed regarding service impact? So really the purpose of this form is to support you as a care manager to have those really thoughtful and good conversations and planning moving forward. It will also provide us with some information about the family dynamics and what resources the family is currently utilizing within attendant care and outside of attendant care. So it will be informing us in knowing what that dynamic is and what the current landscape is of those children who are accessing attendant care services through an LRI. There is an additional question about, is the disclosure form just for children? So yes, it is. So that the form really is intended just to be used for minors, children who are under the age of 18, who are accessing attendant care and who the attendant care is being provided by that parent of the minor, so by the legally responsible individual. So there's no need to complete this form for any other adults utilizing attendant care or for children who utilize attendant care but do not have an LRI. So what do we do with the form once it's complete? So once you hit submit, then your form is submitted and it's completed, and there's nothing else that you will need to do. You will have the ability to print your form. And so for your records, if you want to use the information that you gathered to inform how you're going to connect this family to resources or supports, that will be available to you to print, but that's not a requirement. And once the form is completed, then it is submitted, and we will have that information. So there is a question about foster parents. And so asking if the form should be completed for foster parents who are being paid as for attendant care for the child for the minor child. So the form really is intended for the paid family caregiver who is the parent of the minor child. If you have foster care parents who are currently being paid to provide attendant care to their foster children, please go ahead and complete that form. So, because there are some stipends that are, or there's a per diem that foster parents receive as being a foster parent. And so we want to ensure that there is no duplication of services happening there. Sorry, I'm trying to go through the rest. Is there a process for spouses, or will there be a form for spouses? So at this time, we don't have plans to create a form for spouses, but we may determine that it is needed. I would say if that's something as a care manager would be helpful to you, please let us know, because we really do want to support care managers through this process, and really being thoughtful in that planning as the transition is occurring.
Heather, this is Holly. May I jump in on the spouses?
Yes, please do. I was looking through.
Yeah, you're fine. That gives you a little bit of time to look through some of the other questions. The spouses that are currently providing attendant care can go ahead and make that transition to structured family caregiving right away. They do not have to wait till July, because it is allowable for a spouse to provide structured family caregiving today. So on the A&D waiver. So that can proceed and will continue after July 1st for spouses to provide structured family caregiving.
Okay. And there is a question around, please, thank you, Holly, for that. It says, please give a sample of the HIPAA name on the form again. And so the HIPAA name would just be the legal name of the child, so the first and last name. Again, there are some questions around being able to access the form, and those forms, the form along with the companion guide, as well as the side-by-side document to help you with those conversations, will be emailed at the conclusion of the webinar to the AAA and ICM directors. And so then they will send that out to all of you. So Kara,
this is Kathy. I just wanted to also, I know there's been some questions about timing of things, of how, and Heather, I think, talked about this a little bit, but I just want to reemphasize just, this could be occurring during your 90-day meeting with the individual. However, this could also be occurring in a follow-up communication or touch point with them. So I just want to make sure folks know and maybe Heather or Holly, if you want to speak to that a little bit, maybe to help folks understand the timing of things and when we need this information.
Yeah, so I didn't want to step over Holly. So the completion of the form, if that's what you're referring to, Kathy, is we need that completed form by March 15th. And so so with that information, what we hope is by gathering the information over the next month, that gives you ample time to assist the family to prepare for that transition to the July 1st deadline, and will also provide us with some information that maybe we need to, of additional resources or things that we might need to provide you as care managers or individuals and families through this transition. Holly, did you want to add anything to that?
I think the only other thing I would add is just reinforcing or reminding that those quarterly visits can no longer be virtual. We don't have the authority for those to be virtual. Our waiver document notes that those are in person. So those regular quarterly visits by care managers should be should not be virtual. They should be in person.
Thanks, Holly. I just wanted to make sure that in some situations, it might make sense if you've already done your quarterly in-person visit. This obviously would be a follow-up activity for you to get it completed by the March 15th deadline. And as Holly just mentioned, with the end of the public health emergency in November, the allowance for virtual visits ended. And so if you are still completing 90-day touch points or visits virtually, you do have to stop doing that in order for us to be in compliance with the currently approved age and disabled waiver. So just make sure as you're planning and scheduling these could be potentially in person if you have one of those 90-day visits coming up, or they could be a follow-up conversation that could be outside of that, could be done virtually.
Okay, thank you, Kathy and Holly. There is some questions around a timeline for when you will receive a response through the Medicaid email. So those emails are reviewed daily. And so based upon the question, those responses will come out to you as soon as possible. So please keep in mind that when you are emailing, that Medicaid email is very busy. And so please make sure that in the subject line, you put paid family caregiver disclosure form so that it can be flagged for our team to know that those are the ones that we need to answer in relation to completion of this form or in relation to the companion guide that will come with the form. So, and then also just as a reminder, this form will only be completed for those children who are currently actively using attendant care services who have a parent, a minor child, sorry, it will only be completed for a minor child accessing attendant care whose parent is paid staff. So they could be the complete paid staff, or they could only be being paid for a portion of the approved hours. But that is for whom the form should be completed. So Kara, I'm trying to look through questions, but not sure if you have any additional comments or responses related to any of the questions that you were seeing.
I don't think so.
Okay. So, so we do appreciate you taking the time to join us this afternoon. Please know that all of your questions have been recorded, and anything that you have in relation, any questions that you have in relation to the disclosure form or the companion guide, you can send to that Medicaid email address. Again, a recording and slides will be available on the Medicaid Strategies webpage. And as soon as we end today, we will send all of those materials directly to the leadership of the AAAs and the ICMs. So Kathy, Holly, do you have any additional comments before we close?
I do not. There are, as the other questions are sent in, or as we go through other questions, we will work to get those responses out too. And I just want to say we appreciate your partnership in getting this information and in supporting families in helping them transition during this time period. So other than that, I don't have anything further unless anyone else does.
This is Kathy, and I would just thanks everyone for joining today. I know this was quickly approaching on everyone's calendars. Again, this will be recorded, so you're welcome to go back and revisit different points along the presentation, and would just want to clarify the provider side of things, that the providers are also being asked to submit some information to us. In fact, they have a due date coming up soon by which they're going to be sharing some things. And so we're collecting information from a variety of different sources. I think one, to better inform our work in supporting people who are legally responsible individuals and providing care, and also for just our future planning and support of LRIs in general. So just know those are two separate. So even though provider is submitting information, we're also going to be doing this piece to help, as Heather said, really to help start the conversation with individuals and families and helping them think about some next steps in the transition to July.
All right. Thank you, Kathy and Holly and Kara, and thank you all for joining us today and for the tremendous work that you do with families. As always, we hope to be a resource for you. And if you have any questions, you have the links on how to ask those questions. Thanks again, and have a wonderful afternoon.